about 21 hours since I got out of surgery. I had a superficial parotidectomy with an SCM flap reconstruction, and the reason I had it was for a parotid tumor in my left side. It was a pleomorphic adenoma, which is the most common type of parotid gland tumor. I've had it for probably about a decade, and it started out the size of a small pea. It was always very hard, like a little stone, and I got it when I was in my late 20s, I would say. I had it checked out at the time, and the doctor back then told me not really to worry too much about it, but if it ever grew or started to hurt, to have it checked again. It never started to hurt. It was always painless, but it did grow, I think probably to the size of a marble. And so just recently I went in again to an ENT and had it checked, and he felt that it should be removed. And so I've gone through this process, and here I am the next day after surgery. Prior to surgery, he ordered 2 tests to make sure he knew what he was working with. The first test was a fine needle aspiration biopsy, and that was not too terrible. They gave me a local anesthetic in my cheek, and then they used their contraption to put a needle into the tumor and pull out some cells. It was not painless. It was uncomfortable, and my face was sore for a couple days, but it wasn't horrible. Luckily, the cells came back as benign, so hopefully the additional pathology they do on the tumor they took out yesterday is also benign, but it looks that way, so that's the good news. The second test he ordered was an MRI, and I was not able to do the MRI. Claustrophobia set in when I saw the machine, and after a little bit of an anxiety attack, we determined that wasn't going to work. So rather than do medication and try to sedate me, he changed the order to a CT scan, and that was actually okay. The CT scan I could tolerate, and I did fine with that. So that was able to give him a picture of the tumor and I guess give him a better idea of what he was looking at. The tumor for me was located about 1.5 inches, I'd say maybe like about here, 1.5 inches in front of the ear. Most people that have these pleomorphic adenomas, it seems like anyway, they're closer to the ear, either right below the ear or right in front of it. So mine, I think, was a little further forward. So they had to do a little bit more dissection. The big risks to the surgery were nerve damage, and that doesn't seem to have happened. Luckily, the tumor was not involved with the nerves, and I can still move my face, like I can smile and, scrunch, and I can move my eyebrows. So that was good. I was really worried about that, and that seems to be okay. I mean, my face is puffy, and I've got some bruising, and I'll show you the scar in a minute, or the incision in a minute, but it seems to be okay. And then the other complication that sometimes happens is something called Fry syndrome, where you get saliva, your salivary nerves, I guess, when they grow back together after surgery, they sometimes attach to sweat glands, and that can cause you to sweat when you eat, which is not very nice. So to avoid that, that's why he did the SCM flap, which is they take a piece of muscle out of your neck and put it where the tumor used to be, kind of to fill it in and to keep those nerves from growing into the skin. So I will say that the pain that I have now is mostly associated with my neck more than my face. Anyway. So I guess I'll show you the incision. They cut in front of the ear and then up and back down. It looks pretty bad. The stitches are in. They'll be in for, I think, about 5 more days, and then I'll have them taken out. This white gauze here is covering where the drain was. There was a drain put in for the first several hours, and I had that taken out this morning. I had to go in at 9 a.m. and have that removed, and that's just covering where the drain was. So, and that was pretty quick, and it didn't really hurt to have that taken out. I'm on medication, and so that's managing the pain. And basically the surgery went pretty well. I went in, I was scheduled to have the surgery about 1:15, so we had to arrive 2 hours early. I got checked in, they took me back and did weight, blood pressure, had to pee in a cup, you know, all that stuff. Then they hooked me up to an IV and gave me fluids. I wasn't able to eat after midnight the night before, or drink, not even water. And that's a little tough when you have an afternoon surgery. And unfortunately, my surgery kept getting bumped because of, you know, scheduling issues, I guess, at the hospital with other people. So I actually didn't end up getting into the OR until 3:10 yesterday. And at that point, you know, I was pretty good until then. And then I had a little bit of anxiety in the room when I saw the big lamps above my head and realized this was really happening. So the anesthesiologist, I think, kind of must have given me a little something, perhaps, or maybe I just calmed down. But, you know, they strap your legs down, and, you know, you're laying down flat. It was just an uncomfortable feeling, but I got through it. They ask you to, like, picture yourself on a beach. I actually pictured myself at the entrance to the Magic Kingdom, which is my favorite place, and that did sort of, like, calm me down. I got through it. Within a couple minutes I was out, and I don't remember anything until I woke up in recovery. And at that point I noticed that my throat was really scratchy. They did insert a breathing tube, but I knew nothing of it. You know, they put it in after you fall asleep and it's gone before you wake up. But I do feel like the day after you go to a concert or something and you've been screaming, like your throat's really scratchy. So I do feel that. I also was very hot. Like I kept having hot flashes, and I still have them here and there now. My temperature is a little bit weird. He asked me if I was in pain. I was at the time, in a little bit of pain, nothing horrible, but they gave me a little more medicine through the IV for that, and it kind of calmed it down, made me sleepy. I'm still groggy, and as you can hear, I'm slurring my words and I'm on medication. He asked if I was nauseous, and I was not nauseous at the time. When I first got out, I was fine. I did experience some later. I had an oxygen mask on, and then at some point they took that off. And I was taken to a second recovery room where my family was able to join me, and that's where I got off of the gurney, and they put you in a reclining chair. Then I did feel nauseous. It was the motion. Motion is still getting me. My equilibrium's a little bit off. And my hearing is muffled in this ear. It's very like having cotton in your ear or something. I can hear, but not as much as normal. So that's another weird little thing that's happening. I'm numb, probably from here back. I can't feel my ear when I touch it. I can feel parts of it, actually. That's not true, but some of it just, you can't really feel it. But I can feel my face here, and I can feel my chin and over here, and all this is fine. So overall, it seems to be a success. I'm really happy that I woke up, first of all, because I was a little freaked out about the anesthesia, and secondly, I'm really happy that my face can move and I don't seem to have lost any of my nerves. So that's pretty much it. There's another video that I took this morning that has the drain. So if you want to see that, then take a look for the drain video. And that's it. Hopefully this helps. Bye.